This is Tara here from the medicine shop here on Prince Street, otherwise known as Lenny's wife. This will be my first video that will hopefully go up on our Facebook page, and you'll have to give me some feedback on how I do as compared to Lenny. Today I thought I would talk about some of the new services that pharmacists across Nova Scotia are going to be able to provide, and what that means for you as patients. So in the past, pharmacists have been able to assess and prescribe for 30 different minor ailments. And come January 1st, there's a couple of new things. Actually, it started December 1st, but the government is actually going to provide reimbursement to pharmacists starting January 1st of 2020. And those new things are the assessing and prescribing for urinary tract infections, shingles, and birth control or oral contraceptives. What that means for you is that it may not mean a trip to the walk-in clinic or to your family doctor or to the emergency department. When we say that as part of the assessment, an assessment might not necessarily always result in a prescription. There are certain criteria that you would have to meet. When we take a look at a urinary tract infection, for example, you could not have had more than 2 in the past 6 months. You have to have symptoms that are consistent with the urinary tract infection, like increased frequency of urination, pain upon or stinging upon urination, and there can be no sort of vaginal symptoms that might indicate that it would be a yeast infection rather than a urinary tract infection. The other thing is, as a female, that you could not be pregnant. So another thing to keep in mind. But there are certain things that are basically hard stops where we would then have to still refer you on to a primary physician. But if it's a typical urinary tract infection that you've had in the past, then likely we'll be able to help you out. It might mean less stress on the healthcare system and ease of prescribing for you. The other thing to keep in mind is that when you see a pharmacist for an assessment, normally what happens with any prescription is that your physician has prescribed it and you take it to the pharmacy. Your pharmacy has access to all of your previous medical history, and it's the pharmacist is a second check. We obviously monitor for drug interactions and duplication of therapy and so on and so forth. So there's traditionally there's always 2 sets of eyes on every prescription, whereas coming to a pharmacist, that might not necessarily be the case, but it is sort of within your right to have an assessment done at one pharmacy and then if you've been prescribed a prescription, to take it to another to have it filled. So I know at some of the online comments that I've read when sort of some of this information was released earlier this month, there was some concerns expressed by patients, but keep in mind that pharmacists are trusted healthcare professionals, and we want your best healthcare interests at heart. So, yeah.